Let's start off with the treatment and management of anxiety disorders and fear-related disorders. This happens to be the third section for the fourth unit, that is anxiety disorders and fear-related disorders. If we talk about the first two sections, the first unit is always, if we talk about clinical psychology, the first unit is always have to do with the diagnostic criteria. The second one has to do with explanations, and the third one consequently has to do with the treatment and management of anxiety disorders and fear-related disorders in this case. So if we have a closer look at this, we see that our syllabus is divided into two major parts. The first bullet over here refers to how behavioral therapy could be used to treat and manage individuals with anxiety disorders. And the second part over here refers to how psychological therapy could be used. So while discussing behavioral therapy, let me remind you all, according to the behavioral explanation, individuals learn abnormalities, individuals are conditioned. If I may remind you of the research that was conducted by Watson on the little boy, young Albert. If you remember, there was an association developed, and through this association between metallic sound and the white rat, the response eventually turned into the boy crying for. Initially, the boy was actually scared of the metallic sound, but after several trials, after seven trials to be more specific, the boy did not now need the metallic sound, and the response of crying was a response just to the white rat too, because of an association being developed. So if we take this a little further, number two, we talk about psychological therapies over here, and while discussing psychological therapies, we try to understand through this research that was conducted by Chapman and D-Lab. This research is a key study, and of course, when you talk about a key study needs to be uh, given the due respect it deserves. And in this particular key study, or through this particular key study, we would talk about how cognitive behavioral therapy, that is CBT, along with applied tension, could be used to treat an individual rather, because this is a case study, an individual who has blood injection injury phobia. So taking this ahead without any further ado, CBT and applied tension being used in this study on an individual whom we would later refer to as Mr. T, trying to treat him for blood injection injury phobia. For the CBT part, you must be all aware of what CBT is. CBT stands for cognitive behavioral therapy. The idea over here is to change an individual's cognitions, so that eventually, consequently, you could change the behavior of the individual. And applied tension, as we talk about applied tension, what exactly is applied tension over here? जब हम अप्लाइड टेंशन की बात करते हैं, और as we refer to applied tension over here, we're actually referring to the extent to which particular muscles could be tensed, and applying tension to these particular muscles helps an individual, or keeps an individual from his or her blood pressure to drop. And this is usually used as a treatment or a management technique for individuals who are suffering from blood injection injury phobia. So yeah, understand the logic here. Applied tension is a psychological technique. It's a psychological technique that you use to treat blood injection injury phobia. You usually do this to help individuals, or to keep individuals from fainting, because blood injury injection phobia is that unique type of phobia that has more chance of an individual experiencing a physiological reaction, that is in terms of fainting, as compared to other fear related disorders or anxiety disorders. So when you talk about applied tension, this particular method involves teaching individuals to deliberately, I repeat, to teaching individuals to deliberately tense their muscles to increase their blood pressure. Now you are deliberately teaching individuals, training individuals, helping individuals learn how to tense their muscles so that they could keep their blood pressure up. And by doing so, you're trying to prevent them from fainting. Now, let's begin. Bismillahir Rahmanir Rahim. We're starting off with the behavioral therapy, that is systematic desensitization. Now, as I refer to systematic desensitization over here, as we speak about systematic desensitization over here, as the name suggests, what are we trying to do? We are trying to desensitize individuals. We're trying to desensitize individuals towards a particular, let's just say, stimuli or a stimulus. You're trying to desensitize individuals towards a particular, why does this not work? Okay, stimulus. And you're trying to do this in a systematic manner. This is the easiest way we could put this. So systematic desensitization is an example of a behavioral therapy or a technique. This is an example of a behavioral therapy or a technique. What do I mean when I say this is an example of a behavioral therapy or a technique? Remember, a couple of minutes ago, what I said was, according to the behavioral approach, according to behavioral psychology, individuals learn abnormalities, individuals learn to fear from particular objects or situations based on the prior experiences that they've had, right? So when you talk about systematic desensitization, when I refer to this as a behavioral therapy technique, I'm actually referring to how you could help that individual unlearn it, right? So for you to develop it, you learned it, and for you to now treat it, you'd want to unlearn it. Now, how does this work? If we speak about systematic desensitization, like I said, this is a behavioral therapy. Now, through this behavioral therapy, you try to reduce an undesirable response. Now, you're trying to reduce an undesirable response to a particular stimulus or a particular specific phobic situation by using counter conditioning, right? So, let's just say an individual experiences a fearful response towards any particular stimulus. You try to replace this by making that particular individual feel relaxed, right? So we would be discussing this under the heading of counter conditioning, right? Understand this word, you counter conditioning, right? So the based on the presumption that your conditioning or the association was developed through a prior experience. So if you have developed an association through a prior experience, now you'd want to counter condition this. You'd want to counter condition this. You want to counter condition this so that that particular fearful response is now replaced by a relaxed response. And of course, all of this requires a lot of dedication, a lot of homework, and all of this requires a lot of efforts to be put in. And the extent to which it works for one individual, it might not work in the same manner for another. But bear this thing in mind, this doesn't really have any what do you call it, side effects. So that this gives this particular method an upper edge over using medicines or drugs to be able to treat individuals who suffer from anxiety disorders. Now, to begin with, as we speak about systematic desensitization is a behavioral therapy. It's a behavioral therapy technique that is used to reduce undesirable responses. You're using a particular behavioral therapy to be able to reduce undesirable responses, such as fear to specific phobic stimuli. It is based on the principles of counter conditioning, right? Counter conditioning, I just explained it to you, where the conditioned response of fear is replaced by a relaxed response. So you're trying to now replace a conditioned response of fear with a relaxed response. Here you go. Now, this therapy is particularly effective for phobias. This works out really well for agoraphobia and social anxiety. And this was developed from the idea that if a behavior can be learned, it can also be unlearned. So if a behavior can be learned, remember this learning part has to do with the development of a particular phobia or an anxiety or a fear related disorder. If this is the cause, the unlearning part is the treatment here. And this is the principle on which this entire thing operates. Now, taking this a little further, over here, I'd want to introduce to you this concept of reciprocal inhibition. The term reciprocal inhibition. What does the word reciprocal inhibition over here mean? When we use the word reciprocal inhibition, this idea was initiated by Mr. Joseph Wolpe back in 1958. So when you talk about reciprocal inhibition, the idea is that an individual cannot be experiencing, and in an individual cannot be experiencing two extreme emotions at the same time. It is impossible for an individual to simultaneously be experiencing two totally opposite emotions. In other words, what I'm trying to say is cannot, an individual cannot just be, let's just say, fearful and relaxed at the same time. Now, that's something that is not even possible, right? So you would either be fearful, you'd either fear something, or you'd be relaxed, you'd stay relaxed, right? So Joseph Wolpe in the year 1958 claims the principle that it is impossible to experience, two opposing emotions simultaneously. So what you try doing over here is you try to replace this fearful response with a relaxed response. Taking this a little further, Joseph Wolpe in 1958, the principle that it is impossible to experience two opposing emotions simultaneously. For example, fear and relaxation cannot co-occur, which means that by pairing a phobic situation with relaxation, the fearful response would automatically weaken. So the more, so when the researcher or when the therapist tries helping an individual stay relaxed when that particular individual encounters that particular, again, specific phobic stimuli, if you're replacing the fearful response with a relaxed response, automatically you're treating the individual, you're making the individual feel better, and you're making the individual uh, encounter that particular situation. Now, if I take this a little further, we could speak about the different stages of systematic desensitization as well. As we speak about the different stages of systematic desensitization, I'd want to broadly divide this into three different categories. The first one to begin with would be a relaxation technique. Now, remember, fearful responses are to be replaced with relaxation. And for you to be able to help an individual relax, it might as well be essential for you to teach that particular individual any relaxation technique. So step one over here is relaxation. Step two over here is the creation of anxiety hierarchy. Now, what is this anxiety hierarchy over here? A tiny little tip, if you remember the study that was conducted by Savidra and Silverman on this young boy who was being treated for button phobia. If you recall, the young boy, along with the young boy, the researchers, they created a fear hierarchy. And just to remind you again, the little boy was the most fearful when he encountered tiny small buttons, and he was less fearful when he encountered larger buttons. So, creation of an anxiety hierarchy from what the patient is the least scared of to what the patient is the most scared of, right? And this would again be a step by step approach, but we discuss this a little further. We discuss this more in a bit. Number three, we talk about gradual exposure. So, step one, you help the individual relax. Step two, you help the individual with creating an anxiety hierarchy. Step number three, you gradually expose that individual towards that particular fearful stimuli step by step, one step at a time, ensuring that at each stage the patient uses the relaxation techniques that you had initially taught the patient to stay calm and relaxed, so that any sort of anxiety that the patient could have possibly encountered doesn't happen. Now, taking this further, like I said, three different techniques over here: relaxation technique, creation of an anxiety hierarchy, and the third one over here is gradual exposure. Starting off with the first one, patients are taught relaxation techniques. Now, you teach patients relaxation techniques. These relaxation techniques could be progressive muscle relaxation too, that you've studied about before. Now, as we speak about these progressive muscle relaxation techniques, this might include deep breathing exercises or any sort of visualization techniques. However, this might not work for everyone. And if it is not working for everyone, and if it is not working for any particular, let's just say, individual, in that case, as a therapist, you might as well also want to use some anti-anxiety medication, because you want to ensure that the patient does not feel very anxious. You want to ensure that the patient does not feel very anxious when that particular patient experiences, or rather say encounters, that fearful, that phobic stimuli. So Relaxation techniques. Patients are taught relaxation techniques such as progressive muscle relaxation, deep breathing exercises, and visualization techniques. In some cases, anti-anxiety medication may be used to help the patient achieve a relaxed state. Number one. And number two, you create an anxiety hierarchy. Now, the patient and the therapist, they work together. If the patient and the therapist, they're working together, this allows flexibility. This would probably make the patient feel more in control over the situation. This might make the patient feel more involved in his treatment. Of course, if the patient is involved in the treatment that he or she is going through, the amount of the extent to which the patient would feel confident about the therapy would increase, and the likelihood of the patient adhering to it or strictly following it would increase too. So, creating an anxiety hierarchy, the patient and the therapist, they work together to create an anxiety hierarchy which lists anxiety provoking situations. So, you create a list over here that has anxiety provoking situations in it. It's something like this. You've created, let's just say, a list. And starting off with what you're scared of the least, you go on all the way to what you are scared of the most. So, let's just say the least scary thing to the most fearful or anxiety provoking situation. And yeah, now this particular anxiety hierarchy that you're creating, this is unique for every individual. And when I say it is unique for each individual, this is another additional, this is another plus point to this, because this makes it more customized. So the list is unique to each individual and provides a step-by-step approach to confronting the feared object or situation. So you go step by step, from step 1 to step 2 to step 3 to step 4 to step 5 to step 6 to step 7. I mean, it totally depends on the number that you have on your list. Remember, this is unique to you, just you. And at each stage, the therapist wouldn't allow you to move from one stage to another until and unless you feel calm and you feel relaxed. The third stage that we have over here is gradual exposure. As we speak about gradual exposure over here, the patient is gradually exposed. Remember, gradually, step by step, one step at a time. So the patient is gradually exposed to each stage of the anxiety hierarchy, starting with the least anxiety provoking scenario and going all the way to the most. At each stage, the patient uses relaxation techniques to remain calm. So you use relaxation techniques to remain calm and avoid experiencing anxiety. The patient would only move from one stage to the next in the hierarchy once they report fearing no anxiety at the current stage. So only when you feel confident that you do not feel anxiety over here at all, then you move on to the next stage, and this goes on and on and on. Now, this was these were the three different steps that are typically used when you talk about using systematic desensitization. When you talk about using systematic desensitization as a treatment to anxiety disorders or fear related disorders. So this list that you see in front of you is an example of a hierarchy that could possibly be used for individuals suffering from spider phobia. This is again pretty similar to what we just discussed. The least fearful stage could be looking at a drawing of a spider. Moving on to, once you calm and you're totally okay with this particular stage, you move on to another, that is looking at a detailed photograph of a spider. The next one could be watching a video of a spider making a web. The next one would be being in the same room as a caged spider. The next one could be standing in front of the spider's cage. The next one could be standing next to someone holding a spider. The next one could be touching the spider while someone else holds it, and the next one could be holding the spider in their own hand. Brave, super brave. So from someone who was not at all confident, not at all comfortable with maybe merely looking at the drawing of a spider, you have slowly and gradually, one step at a time, ensuring that you are calm and relaxed and confident to move on to the next stage. You get to the point when you are able to hold the spider in your own hand too. Now let's move on and quickly discuss the effectiveness of systematic desensitization. So we have some psychological references over here. There was this study that was conducted by Agras in the year 1967, and this was for individuals who were suffering from agoraphobia. It worked out well. Another psychological reference that you would want to memorize maybe the study that was conducted by Kimura et al. In 1972, and this had to do with the fear of snakes. Bear this thing in mind. This specific method was more popular back in the 1970s as compared to today, because today there have been more direct exposure based therapies that have gained a lot of prominence and popularity. I hope this was helpful.